Trust your club.
Hello and welcome to Blue Dream Love and Wellness. Tonight, we're talking about a little bit tougher of a subject. It's called the trauma webinar. Now, I know, and I'm going to open y'all up here. Has everybody had a trauma in their life or been through a trauma? Everybody, yes? Okay, so we all know what depicts and how it goes, right? Let me share my screen here. Come on. Here we go. So as we know, trauma can be very detrimental in our lives. Now, if you have a comment or want to ask a question, please put it in chat for we can make sure those all get answered. Now, trauma, as we all know, is a response to a deeply distressing or disturbing event that overwhelms an individual's ability to cope, causes feelings of hopelessness, helplessness, and diminishes their sense of self and impacting their actual ability to feel a full range of emotions and experiences. Research shows that the dramatic impact of trauma that is multifaceted affects various aspects into individuals' lives. Since we are all so unique, it is going to affect us all differently. So this may mean that mental health gets impacted, physical health, emotional, your cognitive, behavior, your interpersonal relationships, occupational, and educational impact. It will hit it across the board. And that is why it is so vitally important as us as practitioners to treat this very cautiously and carefully. So the three type of traumas here, well, I'm actually going to go over four, but acute trauma, as we all know, occurs from just a single incident. Chronic trauma is repeated and prolonged, such as domestic violence or abuse. Complex trauma is exposure to varied and multiple traumatic events, often an invasive and interpersonal nature. Now, remember, all traumas can be emotional, mental, physical, and spiritual. And when you're working with trauma, you need to ask this: is this a spiritual imbalance? And go through them and release them all so they can heal. It will be layers that are going to be removed when it comes to trauma. You need to be very careful. You need to watch their eyes, keep them present in the moment. As soon as they go off script, or their eyes go left, or their eyes glass, you've lost them, and you need to bring them back. Bring up any subject to bring them back into the room because they will get lost quick. Now, acute trauma itself refers to trauma that is incurred, as I said, to a single event. The event itself was so overwhelming that our autonomic nervous system, the branch of our nervous system responsible for our survival, became stuck in its threat response. That overwhelming threat, which could have been from anything, for instance, it can be from a sexual abuse to a natural disaster, elicited a threat response in the body. This is supposed to happen. Our autonomic nervous system has worked to respond to threats effectively for thousands of years. Unfortunately, at times when we go through so much trauma, our body stays stuck in flight, fight, and freeze. And this frontal lobe goes back into the primitive mind, and we can't think fully. That is where that, oh my gosh, comes in, that technique where you do your thumb and forefinger on your temple and across the neurovasculars to breathe and bring that response back. When you are working with your clients, symptoms can include flashbacks, and that's really common. Even through processing, they can have flashbacks. Be available. Let them know this. Work it through with them. They can have nightmares that they feel that they are in the thick of it right then and there, and severe anxiety. Through the belief code and some other modalities, we can bring that anxiety down so they can handle their trauma. They can have uncontrollable thoughts about the event and stay back in the events. The people that go through these really do have temporary difficulty in adjusting and coping with life, but with a good deal of time and the right type of loving self-care, they can get better. Once you work with those triggers, remove those triggers, life does get happier. It does take time. The autonomic nervous system, as I was saying, does return to normal after an acute trauma occurs. Acute. However, again, at times this does not happen, and the excess hormones of adrenaline, cortisol, and noradrenaline react within the body, and it keeps it vibrating, and you sometimes it will adjust your breath. There's many things that can happen. Now, chronic trauma. Does anybody have any questions thus far? Please don't hesitate to ask. I don't want you to go away not understanding. Chronic trauma refers to the trauma that occurred repeatedly over a prolonged period of time. Unlike acute trauma, which is associated with a single intense event, chronic trauma, as I stated, is ongoing stressful situations. These could be in forms of domestic violence, long-term illness, prolonged combat exposure, or any situation where the individual is exposed to repeated traumatic events over and over again. Now, examples of chronic trauma include continuing with the domestic violence. If you've got someone, a client who is being domestically abused, you need to find resources for them and get them help. If you know of somebody that's being bullied, we need to get them help and teach them how to stand up. Chronic medical illnesses, white coat syndrome, there's a lot of it going on out there with invasive medical procedures, and some don't need to be done. Homelessness, hopelessness, the neglect, the starvation or deprivation that is going on, the ongoing war or combat, and witnessing this constant abuse of a partner or a family member. This subject is really high for me because of the abuse that I have been through in my life. So if I get a little emotional, please forgive me. When you are in chronic trauma, you feel absolutely worthless. You feel shameful and you feel like it's all your fault. But it's not. It's not. People who are chronic trauma survivors have problems controlling their emotions. They find it hard to feel connected with other people. And they have relationship problems like having trouble keeping friends or partners. And it's a very select few because people don't understand what they're going through and they can't explain it well enough for someone to understand. Now, the complex trauma, it is a distinct from the multitude of other terms that do describe types of trauma exposure or manifestation or post-traumatic disturbances. It is defined as exposure to multiple, often irrelevant forms of traumatic experiences and the difficulties that arise as a result of adapting to or surviving for these experiences. The adverse experiences encapsulated by complex trauma typically begin in early childhood. Remember, we form those beliefs before we're age 7. Yes, we can form them after also, but we do form most of them before age 7, and they are very long-standing or reoccurrent, and they are inflicted by others. Most often, they are perpetuated within a person's formative attachment to someone. Sometimes they're compounded by patterns of risk and dysfunction with structural and generations of families because there is a lot of dysfunction. Frequently, forms of violence, oppression, the best certain people can communicate, particularly these holding minority status within a given society. And I didn't like that, but the outcomes associated with complex trauma span a wide range of psychiatric diagnoses and misdiagnoses, because there are a lot of those. And then they give you drugs that you don't need, didn't need, and make you even worse. So functional impairments, evolving educational, vocational, rational, and health problems. Remember that trauma can affect every single factor of your life. They do create stress reactions. People often say that their first feeling as they're getting over is that they were alive after this traumatic event. But then it's followed by the stress, the fear of what happened, and now its magnitude, it's huge. And then the anger comes in. And who does that serve? It doesn't serve them. It certainly doesn't serve their liver. Trauma may also lead to people to find they are unable to stop thinking about what happened. And it is hard because we keep looking, what if we'd have done this? What if we'd have done that? Oh, if only. But we can't change it. It already happens. Let's work on getting you better. Research has shown that traumatic experiences are associated with both behavioral health and chronic physical health condition, especially those traumatic events that occur during childhood. Substance abuse, mental health conditions, other risky behaviors have linked with traumatic events. And that is very true. I know a lot of people who cover their pain up with alcohol and substance abuse. But as soon as they wake up, it's right back in their face. So, across the lifespan, complex trauma is linked to a wide range of problems, as I already said, and I'll say it many more times: addiction, chronic physical conditions. If you're always staying in the past, staying in that negative field, what is your body going to do but be negative and be sick? There's nothing for it to be positive about if you can't be positive. Depression, anxiety, self-harming behaviors, so many psychiatric disorders beyond the consequences for the child and the family itself. These problems carry high costs for society as well. Many trauma survivors report significant change in their physical health, including altered sleep patterns such as insomnia, or sleeping more than usual, appetite changes, either increase or decrease, unexplained aches and pains in the body. And I can tell you for sure that there is definitely changes in everything in your body. I was abused before I was even born. And I have been abused my whole life. And since 2 years of age, I have been an insomniac and tried to sleep at night, and it's been really hard. So please know that these are no small feats. Now, I'm just going to touch a second on PTSD. That's a whole other webinar. As we know, PTSD is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, just like with the other ones, as well as uncontrollable thoughts about the event. Vivid flashbacks, usually with the military and others, can occur because they think that the trauma is happening right then, right there. Intrusive thoughts and images can pop up in their face at any given time. The nightmares are horrendous, intense distress, or real symbolic reminders of the trauma. It can be a smell, it can be seeing something, it can be touching a certain fabric. I had a gentleman that I didn't know they used rose water in Afghanistan to clean themselves with, and I used rose water for my face, and he slipped. He went right back into that he was there. So please be careful and watch what you do. It is very frightening for those people. The physical sensations that PTSD have, such as pain, sweating, nausea, and the trembling, and it is heavy trembling. Again, I want to say to you, watch their eyes. It is very important if you've got a PTSD person in front of you and you're not watching their face close enough. So PTSD triggers can be internal, such as emotions, feelings, memories, and thoughts, but other triggers can be external, people, places, situations that remind you of the traumatic event, and they can make them feel guilt, difficulty sleeping, or frightening thoughts. And we'll keep going over that as many times as we need to get that down. A person with PTSD has 4 main types of difficulty: reliving the traumatic event, even through unwanted or recurrent memories, flashbacks, vivid nightmares. There may be intense emotional or physical reactions when reminded of the events. like sweating and heart palpitations and anxiety and panic and muscle aches and pain can occur. Now, if they're getting like you feel like they're almost out of control, they can not only do this, they can put their hand here and put their other hand above their belly button. This is the adrenal and the kidney spot, and it will calm the adrenals down and allow the harmony. You can also put your hand here and tap and get them to calm. There's other ways that we can. Hotline for veterans and a hotline for trauma. Please take these and utilize them. Now, the effects of trauma itself, what are the immediate effects? If you've all had trauma in your life, what was your initial reaction? Was it exhaustion, confusion, sadness, anxiety, agitation, numbness, disassociation, confusion, physical arousal, or blunted affect? Most responses are normal in that most survivors and are socially acceptable, psychological, effective, and self-limited. But the fatigue and the exhaustion that come along with trauma, it can be very overwhelming for them. The disturbed sleep can be overwhelming. You can do emotional freedom technique to help you with all of this, and also working with the emotion code, body code, and the belief code. Sometimes trauma can cause them to get nauseated and they vomit and get dizzy. They get headaches, excessive sweating, and increased heart rate. Those palpitations get pretty hard. Some of us who go through trauma may have these feelings during or afterwards. Anger is a big one, and you need to be angry. Numbness or difficulty feeling like any strong emotions, like you have lost your identity or a sense of who you are because of this trauma. And are you back? Do you still have work to do to get yourself back? Research has shown that traumatic experiences are associated with both behavioral health and chronic health conditions, especially those traumatic events that happen during childhood, and we stuff them way down in a hole. And then one day, somebody says something, you smell something, you see something, and that flipping door gets opened and it all comes rushing in. There can be a lot. Some people use substances to help. Mental health conditions and other risky behaviors have been linked with traumatic behaviors and experiences because they feel that alcohol, those drugs, will numb them out and they won't have to feel. Depending on how you're affected, trauma may cause difficulties in your daily life. It may be harder to trust people, which can make relationships very difficult and friendships harder to maintain. You may struggle to look after yourself, to take care of yourself, just do simple little things, to even hold down a job or take pleasure in the things that you used to enjoy. It's time we get those back and have a life that we were meant to have. So social interaction and relationships following traumatic events, the emotional distressed experiences can make it very difficult to relate to others. And I know I said that already, but I'm going to keep saying it. This might mean that the person that went through this trauma withdraws completely from your family, from friends, stops attending social activities, becomes very overprotective, and has a very difficult time expressing or managing their emotions, this person needs help. At times, when we have gone through trauma, we self-isolate because we don't want to be around anybody. We don't want to hear it. We don't want to see it. Traumatic events can have an incredible isolating effect, as you may have a difficult time telling others how you feel. Or do you have to tell them how you feel? Or they even believe you when you tell them how you feel? Or you believe that no one will understand what you're going through. But many people have gone through it. They may not understand your unique circumstances, but they understand it as a whole. These patterns can lead to distance in relationships and social and emotional isolation. I know I did. I wouldn't talk to anybody. I wouldn't look at anybody. I wouldn't have to do with anybody. Nothing, nothing, nothing. I was done. Intrusive thoughts. Sometimes they're just awful. Intrusive thoughts. Trauma can cause these intrusive thoughts, or again, those flashbacks, which can interrupt your communication and make it difficult to focus right now on the present moment. Feeling detached from family and friends, well, it's a common trauma symptom and can obviously make it hard to open up to others or to experience empathy. Relationship trauma itself develops as a result of an abusive, intimate partner relationship. Relationship trauma includes PTSD-like symptoms and also includes feelings of anger and fear toward that abusive partner. So coping with it is not easy, and it takes a lot of skill to learn. Relax. I know it's really easy. Just relax. It doesn't work like that. We have to practice using relaxation techniques, something as simple as yoga, square breathing, meditation. Do something you enjoy, such as listening to music. Crank that stuff up, feel it in your bones. Go outside and get in Mother Earth, do some gardening. Express your feelings as soon as they arise. And if you have no one to talk to, write them down. Get it out of you. Quit stuffing it right back down. Traumatic experience can trigger a wide range of emotions, as we've already talked about. And survivors may find it very difficult to express these emotions. And it is hard because you've already been judged. You've already been treated like crap. You've already been through this trauma. What's next? One of the most important steps in healing from relationship trauma is to acknowledge and process your emotions. This may involve talking to a therapist, a trusted friend, journaling, or engaging in other forms of self-expression. There's so many things that we can do. So there's 3 stages. First stage, safety and stabilization. Are you safe? Second stage, remembrance and mourning, because you are going to mourn. Third stage, reconnection to yourself and to life as a whole. A good coping strategy is to find somebody to talk with about your feelings, not somebody that's going to judge you, not somebody that's going to run off and tell every Tom, Dick, and Harry they see, you need a confidant or the Lord. A bad coping skill would be to turn to alcohol and drugs. Having a positive coping strategy and learning something from the situation as a whole can help you recover from the traumatic events. And sometimes it does take us a while to understand. Homeostasis is vitally important, and to understand the process of releasing this trauma, we must first understand we are before the release happens. So the triggers, the trauma release, the rage, the grief, the compensation, the identity loss, the insight and integration, the homeostasis. As a practitioner, we can go in and work with these. You need to seek counseling. If you need to, do not hesitate. Your life matters. You matter. Reach out. Reach out to me. I'll help you. We are here for you. We love you and support you, and do not want you to go through this alone. Not now, not ever, because I went through it alone and it was pure hell. Don't do it alone. So treatments. These are the type of treatments that there are out there. Cognitive behavioral, cognitive processing, cognitive therapy, prolonged exposure, brief illicit psychotherapy, eye movement, EMDR, narrative exposure, medications, connect with a certified counselor, or energy medicine. Gradually, you're going to confront what has happened. Don't try to block it. Don't bottle up your feelings, let me tell you, because I did for over 40 years, and when it came out, it wasn't good. Talk to someone who can literally support you and understand you. It is so vital. Try to keep your normal routine and stay busy. Don't go out of your way to avoid certain places or activities. Understand how trauma can affect people, including how mental health problems can be reactions to trauma that they have buried and they haven't talked about. Ask sensitivity about past traumas and offer appropriate support if you disclose it. Understand how mental health services can harm if they are not trauma aware. So a support system, A to Z, the support systems will help you improve your overall health and have been shown to reduce stress and anxiety.
Okay.
Having a support system means that you have people to rely on when you need them the most. It means that there are people you can lean on whenever you are in a tough situation. If the trauma involved injury, their physical health and finances may also be affected. There are support groups. Offer a way to connect, help them to connect with these challenges. It's really easy to get information for people and give it to them because their heads are not, they're in an emotional stress mess. It can reduce the psychological distress, enhance their coping mechanism, and improve self-esteem. Social support provides individuals with a sense of belonging and validation, and that's what they need, which can foster feelings of safety and security, which we all need. This, in turn, helps to mitigate the negative effects of trauma and aids in their recovery process. So family support, vitally important. How to help a family member with trauma. How can a loved one with post-traumatic stress? How can you help? One, be willing to listen. Don't speak, just listen. Don't push. Make sure your loved one knows that you literally want to hear about his or her feelings. Tell me more. Choose the correct time to talk. Recognize when you need to take a break. Get help if there's talk of suicide. And this is the Suicide Prevention 988. Your support is vital. Now, this is prevention and education, so you can go through here and pop on these. Awareness and education, providing accurate information about trauma to students throughout their education, beginning in middle school through professional training, will result in a better informed public. We need to talk to our kids. Better education about trauma could assist in the prevention as well as early intervention and treatment. Facing a trauma situation has far-reaching consequences. There are so many factors that impact how people respond in situations, and nobody's going to respond the same. Raising trauma awareness is a great way to increase support for people who experience these traumatic events. And it doesn't all have to be the same traumatic event. Trauma is trauma. Trauma-informed schools have become essential to successfully addressing the broadening spectrum of adverse childhood experiences, because this is getting to be a real problem. More than half of all young people have reported exposure to violence, to abuse, and by the age of 16, more than 2/3 have experienced a traumatic event. And for me, that's not acceptable. Strategies for trauma prevention. Take care of yourself and your loved ones. Talk. Put down your doggone phones and talk. Take care of yourself. Reach out to family and friends. I know how difficult it is, because it seems like there's only a one-way communicator here, and everybody's so involved in their lives they can't communicate back. But we need to work at communicating and keeping our family and friends in reach. If you have children, talk to them. Don't try to be their friends. Talk. Limit your consumption of news, because boy howdy, it's absolutely crazy out there. Get enough good sleep, quality sleep. If you're having trouble with insomnia, we've got a few things we can do, but you need quality sleep. When you go 22 days without sleep, that's not quality. It's not even quantity. Avoid making major life decisions, because when you do, when you're in an event, you're going to regret it. And understand that there are going to be changes in your life and those around you. Now, the National Child Traumatic Stress Network, it changes the course of children's life by changing the course of their care through expertise in the full range of childhood traumatic experiences and dedication to evidence-based practices, knowledge of child development. Get your self-care first. You can look this up. Give them time. Give these little ones time. If you know something is going on, and sometimes we as parents don't know. Children do not say things. We can't guess. We don't know. So give them time. Focus on listening, not interrupting. Accept their feelings. Don't tell them they're bad. Don't blame them or criticize their reactions. Use the same words they use. If they say something and you're not quite sure, say it back to them to make sure you're hearing what they said to you. Only give advice if they ask. Allow them to express themselves how they need to. And it's going to come in many waves. So these are some more. You can take a picture of this if you'd like, whatever. This will be up online. An online chat where you can talk to people if you're having trouble. Please don't hesitate to reach out. So what is your body language stating for emotional? Now, there were about 10 pages, so I only took a few. For emotional, you can ask the client, are you feeling fragile? Are you feeling weak, lost, like the world has caved in on you? You're not going to believe the answers when this comes out. Do you have betrayal and disappointments? Lack of care, lack of support, stuck, frozen? Are you cold? Are you disconnected from your guidance and higher purpose? Just this little bit will get you a long ways. Now, the physical, are you listening to your own, to universal guidance, or not listening to your own, to universal guidance? We have a universal guidance out there. And if we completely ignore it, then we're off our axis. Deeply resisting change, needing a wake-up call, constantly limiting yourself by allowing negative thinking to take over your life. Remember, we have those two voices, that negative one and that positive one. Take that negative critical one out of the way and place that positive one right back in there, because we will constantly self-sabotage ourselves if we are not careful. So the wounded child, there is, this class was amazing. Amazing, not in good, but it was amazing. So a wounded child, there's a lot more than this, but they feel over responsible. You always want to find out when you're working with a wounded child, what age is that child? And then is it over responsibility? Must they be perfect? Self-doubt, stuck, extreme guilt, and it's not due to their actions. Slavery, lack of confidence, always thinking you have done something wrong. Fear of trusting others. You break a child's confidence and they're not going to trust. Sexual issues. This is coming out more and more and more, that children are being sexually abused. We need to step up and we need to help. So this is just a little bit. And when you go in and ask this, then you would remove all the underlying imbalances, and it will take you most times to the belief code. Now, trauma, when you are working with trauma, when you're working with inner child, the trauma list is humongous, it's pages. So the trauma, I put down betrayal, aggression, delusion, dislike of self, vulnerability, obsession, arrogance, scapegoat, overburden, lack of self-integrity, stress, hatred, frenzy, fear, and panic. And you would ask this, okay, you have an inner child. Is there a trauma listed? Is there a trauma that goes along with this? And if there is, you would go into this. Is there an underlying root imbalance why this is occurring? And a lot of times there's vows and there are oaths against these children at this young age. The belief code is a miracle in some of this. You identify the negative beliefs about oneself, others, and the world. You reframe the beliefs by challenging and reframing these negative beliefs. They can shift your perspective. It's like taking a big, huge chunk out of the library, the bad library, and putting a whole chunk of new back in. It transforms your limiting beliefs into empowering ones that can boost your self-esteem and confidence, addressing and changing deeply held beliefs that can lead to emotional healing. And just on that one, um, when I worked on my family and about the the beliefs that I held, and I released some of these when I first started doing it, I just kept throwing up and throwing up. It was unbelievable what was coming out. Positive belief changes can lead to healthier behaviors. Yes, it can. Healthier beliefs about oneself and other can improve interpersonal relationships. Yes, it can. Increase your resilience by developing a set of positive, empowering beliefs. Absolutely. Adding in mindfulness, meditation, visualization, and affirmations can support your overall mental, emotional, and physical well being. And that's where it's all at. Now, the AO scanner is a very cool little device. It's designed to provide a comprehensive overview of an individual's physical and emotional state by analyzing the bioresonance. Well, these frequencies are very amazing and they can reduce stress, promote relaxation, which can be very beneficial for trauma victims. The scanner assesses can be used to tailor for your own personal use. As far as I'm concerned, everybody needs to have one in their home. It's just amazing. It saves you a lot of money on holistics. But with its biofeedback capabilities, it most definitely does help trauma victims. I know I listen to it daily and I know when I don't. So EFT, I talk about EFT all the time because I believe emotional freedom technique is another component, another modality that we can easily utilize in the comfort of our home, in the comfort of wherever, if we're feeling stressed. And it is simply amazing. So you always want to start with a setup statement, and that setup statement goes on your karate chop point, and you would just go through it. You want to go through the setup statement 3 times. Even though I have this trauma, I deeply and completely accept myself. So when you tap on these points, you want to tap on them 5 to 7 times. And sometimes just 2 fingers. On the collarbone, I just use 1 hand. So your eyebrow point, you can go through this trauma, this lingering pain, this emotional wound, these memories, the fear, the sadness, and you can add whatever is aligned for you. And back up to the top of the head of the crown. You want to reassess it, and I reassess by taking a deep breath and opening my hands up to the Lord. And I muscle test. I test before I start the tapping, and usually mine's in an 8 or 9. I tap before I go to sleep, and I can bring it down to a 0 and lay down and actually allow my body to rest. So you can use emotional freedom technique for anything and everything. Be very gentle with yourself, because trauma itself can take a very long time to heal. Working with a practitioner and utilizing emotional freedom technique and some of these beautiful modalities We can help manage the emotional and physical symptoms that is associated with trauma, promoting a sense of calm and healing. And that's what we want, is calmness and healing. So thank you for joining the webinar on understanding and addressing trauma. I know it's not a fun one to go over. We've explored various types of trauma, their profound impacts on individuals, and the importance of the trauma-informed care. We've learned about effective strategies for supporting those affected by trauma, including creating a safe environment, and that is so important. Promoting resilience, because they have none when they go through this trauma, and utilizing appropriate therapeutic interventions. Remember that addressing trauma is a collective effort that requires compassion, patience, and continuous learning. We encourage you to apply the insights you've learned today in your professional and your private lives, advocating a more empathetic and supportive approach to those experiencing trauma. Reach out to the listed organizations and professionals if you need to, and together we can make a significant difference in the lives of those impacted by trauma. Thank you for participating and your commitment to this critical issue, because we know trauma is occurring daily in this world. We see it, we feel it. Let's stand up as a community and work it. Oh, my love. Thank you so very kindly. No, let me see here. I think I did something wrong.
No,
Okay.
you're good.
You got it? Okay. I didn't think I did. I thought, what did I do? Well, thank you so very much for coming. I hope